Welcome to this learning series titled Family and Couple Therapy Competencies Addressing Religion and Spirituality, or Family CARS. I am Dr. Jen Ripley, and this is my colleague, Dr. Jim Sells.
We are the co-directors of the CARIS Institute at Regent University. CARIS is a resource and research center that focuses on couples, marriage, family, and faith. Mark Twain once quoted a friend and neighbor, Charles W. Warner. Everybody's talking about the weather, but no one's doing anything about it. Regarding the use of religion and spirituality, or RS, in the practice of couple and family therapy, we can draw a similar conclusion. Becoming a culturally competent therapist includes many aspects of diversity. Over the past 4 decades, the research is thick with evidence that RS are essential components of diversity, that clients want to include religion and spirituality in therapy, and that clinicians recognize the need but don't see themselves as equipped to use RS in their therapy. Everyone is talking about it, but no one's doing anything about it.
There have been decades of discussion about religion as an important part of clinical education and practice. But students and therapists report that they are rarely trained during their formal education in specific ways to handle issues regarding religion and spirituality. Also, RS trainings like this one are rare. Why? Several reasons have been put forth. Perhaps it is a vestige of the historic rejection of religious experiences by Freud, Skinner, and Ellis. Some have observed that many mental health faculty and therapists have been found to be less religious than students or the general population. Some have suggested that religion runs contrary to the scientific traditions of the profession. These are important concerns relevant to culturally responsive practice.
In this 5-part training, we'll first self-reflect and explore our cultural comfort with RS in the therapy room. And we will reflect on some great ideas from family systems theory that are helpful in addressing religion and spirituality. In the second video, we'll talk specifically about the research on how spirituality and religion predict family functioning. There is a scientific basis for understanding religion and spirituality in couples and families, just like other aspects of diversity. In the third video, we will review practical ways to assess religion and spirituality with couple or family in treatment and the intersection of religion and other aspects of diversity. The fourth video will focus on interventions to address RS with families and couples in ethical ways as professionals. And finally, in the fifth video, we will apply our learning to a special case. To help us all remember this, we use family CARS in 2 ways. First, the acronym CARS is Competency Addressing Religion and Spirituality in Families. But it also stands for Comfort, Assessment, Research, and Family Systems to help us remember the main ideas. This video series is intended to begin a community of learning conversation with a group of professionals to apply the learning and cases in each module. We hope you enjoy all of it.
Family therapist Froma Walsh offered an interesting hypothesis. She suggested that there is a disconnect between what educators prepare family clinicians to provide and what couples, families, and parents want. That, she says, is why family therapists need more training in RS issues in couple and family therapy. She writes, quote, "Most families and couples who come for therapy or counseling are seeking more than symptom reduction, problem solving, or communication skills. They are seeking deeper meaning and connections in their lives. But it's like we as the therapists are saying, I don't do meaning and connection. I solve concrete problems and reduce DSM symptoms."
Diversity skills are learned. Competency in RS issues is no different. You might reflect on your own comfort with religion and spirituality. Like other aspects of diversity training, such as race, ethnicity, gender, or sexuality differences, they all create tension. This is emphatically true when one is on the outside of the majority. Those in faith traditions enter therapy often feeling that they are on the outside and their RS values will be ignored or minimized. Anyone in a disempowered diversity group is keenly aware of how their interests and values may not be accommodated.
We think it's important to reflect on your own personal religious background and experience. Our work in the therapy room is influenced by our own experiences. So let's examine two aspects of religion and spirituality. Reflect where you sit in terms of your own identity and response to RS. First, do you see yourself as religious, spiritual, both, or neither? In North American culture, we define spirituality as meaning-making and striving that is not focused on a religious tradition or history. Yet, within the Muslim tradition, the Prophet Muhammad said he came to teach one thing: good character. Spirituality in that tradition is inextricably linked to religion. And other traditions and religions may see religion and spirituality as indivisible. So it's important to understand nuances to the definitions of religion and spirituality influenced by traditions.
We've created a simple introduction to this experience. It's not meant to be comprehensive or exhaustive, but it's meant to identify part of the challenge that we face in addressing RS themes. Look at the visual depiction. You might find one of the religious symbols on your screen to reflect your beliefs, or perhaps one that is not part of this. You might be represented by the sun and say, I'm not conventionally religious, but I am spiritual. This is the person who doesn't affiliate with historic religious tradition, but does draw meaning from some manner of transcendental or mystic reality.
Another way to self-reflect about where we are regarding religion and spirituality is to consider our emotional response to religion and spirituality. Emotional experience includes spiritual goals, strivings, and comfort level with RS content that clients might bring up in their sessions. A performer is someone who has many spiritual goals, is very comfortable, and feels positively towards religious or spiritual experiences, and would enjoy being with people who are also on a spiritual or religious journey. Some people are excited, curious, and enjoy engaging in discussions about spiritual things. They may even annoy others with their interest level. And that would put you in the performer category. We divide the performers into two subgroups. Type 1 are those who are within a specific tradition over time that's unchanging, kind of like someone who sings the same genre all their life. And type 2 would be genre-shifting performers, changing over time in meaningful ways with various RS identities.
You might not be involved yourself in RS and are neutral about the topic. We would call this person an audience member, which is much like going to a movie and participating in the audience. If you don't really seek out religion or spirituality, but you also don't have negative experiences, then you're in the audience where you watch RS of your clients and colleagues, but you don't avoid it. This person is interested and curious, but not engaging in spiritual practices much for themselves. A third type symbolized with the no thank you symbol. This person prefers not to be part of the religious or spiritual experience of their client. Possibly the topic evokes painful memories, family discord, or abuse. Maybe you were excluded, devalued, or harmed in the context of religion and spirituality or faith. Then you would place yourself towards the right of the screen with the no thank you symbol. Remember, we are exploring the emotional response to religion or spirituality in your comfort level. It is also possible that you are comfortable in one type of religion or spirituality, but have no thank you emotional response to another type of religion or faith tradition. Maybe you find that none of these fits you, and you have your own ideas of an emotional comfort level with various types of religion and spiritual traditions. It is important to pause at the beginning of this training to not just identify where you are when we enter conversation, but how where we are might influence where we go or struggle going in this training. We are not at all the same.
We encourage you to take a moment, locate where you seem to be right now in your personal journey. You might even write down where you are right now in your life. Are you conventionally religious or unconventional? Both or neither? Are you an active RS performer, an audience member, or a no thank you? Consider your comfort with various types of religions and spiritualities. Or maybe write down your own word to express your own comfort level. There are many other ways of contemplating this topic, but we hope this helps get the ball rolling.
Let's consider your feelings or your comfort level about this training for just a few minutes. Imagine a family immigrating from their homeland into a new cultural setting. You see them stepping off the plane or walking through customs. They know change is about to happen, but they don't know what the change is. Now imagine a client stepping into a therapist's office. Anticipated but undefined change is coming for them also. All people experience the threat or challenge when facing potential changes. In fact, if we don't experience tension just a little or maybe a lot, it could be because we're in a dominant group and we're not required to wrestle with acceptance, to risk rejection, or to deal with a threat of loss. The lack of cultural or religious struggle is called cultural comfort. These are the feelings that arise before, during, and after culturally relevant conversations. We might be uncomfortable with the content, especially if it's new to us or in some tension with our own culture. Or we might find ourselves quite comfortable if the new culture is something like where we currently are or if we're already familiar with it. Engaging in diversity training like this one likely comes with varying levels of cultural comfort for you to be aware of.
In couple and family training, all students bring their own religious and spiritual cultures into the training. The evidence of their culture is usually an invisible diversity factor, but sometimes it is visible, such as in the forms of markings like a bindi or a tilak, maybe jewelry, such as a Star of David or a cross, or their apparel, such as a dastar, a turban, or a hijab. Most people in Western cultures do not show their religious or spiritual identities externally, so it's easier to assume that we all believe and conduct ourselves with similarity. But as you know, we would be wrong to assume that we are all similar. Therapists have varied comfort levels as we integrate our own personal RS identities with the professional identity we are expected to join. For many, this adjustment is easy and it occurs with little struggle. But for some, it's profoundly uncomfortable. Dendy identified this in a qualitative study of RS experiences among clinical psychology students. She reported many students went underground with the conflict experience as they sought to blend their RS self with their emerging professional self. There is not a level playing field in various aspects of diversity among professionals, and that includes religion and spirituality.
For example, I was speaking to a woman who was a Muslim graduate student. We sat by a fountain on a summer day. I wore clothing which reflected the culture of my youth: shorts, Hawaiian shirt, flip flops. She wore her religious cultural dress, the hijab. She spoke of her experience. Everyone knows that I'm Muslim. My clothing declares my devotion to God. I am one of only a few Muslims here, maybe two or three. At the State University, I was identified as Muslim, but seen as odd, as if I was a traitor to all women. But here, I'm not odd, but I am different. I can accept being different. Being seen as strange was a daily battle. Sometimes I wouldn't venture out of my apartment. The stress was daily. I would do my work hidden.
We are suggesting that we carry RS identities into our professional contexts, much like an immigrant carries their home culture into a new host country. The unknown is always present, and with that comes risk, threat, concern, even fear. Clients feel that way as well about their RS identities. Will we be understood? Will we be accepted? Research indicates that immigration is best addressed through cultural humility, and we are suggesting the same as we approach religious and spiritual themes in therapy. Cultural humility is defined as an openness and willingness to reflect on oneself as an embedded cultural being, and an openness to hearing about and striving to understand the cultural background and identity of others.
This attitude of humble, curious engagement can apply to religious and spiritual aspects of families in therapy. When a couple or a family enters therapy, they are bringing their life culture, including their RS, into a context that is, for many, a very different culture.
Consider the experience of a Polynesian family entering therapy. Their 22-year-old son is gay and recently announced he would like to marry his boyfriend. Now, the father in this family is a traditional religious follower and finds this to be a desecration of the family. The mother, however, is the same religion but believes that there is no problem with being gay. She supports her son and believes that the proper religious response is to actively support the son's marriage. The mother is worried about it, although her worry is expressed subtly. The son doubts he wants to do therapy, saying, "It won't help anything." You would use all your diversity skills to assist the family as they address the tensions occurring between generations, but you know nothing about how their organizing religious or spiritual traditions are at work in the lives of everyone in the family. You are, in a way, flying blind as you seek to land your therapy on their Polynesian island. And when we don't understand something, we may read our own religious or spiritual context. So, what are we to do with all of this? How can we curiously explore our cultural comfort level, use cultural humility, and our knowledge of family and couple therapy to serve this family? We offer 4 great ideas from family systems to increase our competency addressing religion and spirituality. We're going to start with introducing these ideas here, and then we're going to return to them a couple times in later videos. You might consider how any of these ideas might be able to help with the case of the family from Polynesia. And to help us remember all of these ideas and these systems concept, we're going to use the mnemonic nuns and monks dance every day. So N in nun is for non-anxious presence. The M in monk is for multi-directional partiality. The D in dance stands for differentiation. And the E in everyday stands for exclusion and embrace. So that's nuns and monks dance every day.
The first great idea is creating a non-anxious presence regarding RS values. The N. Calm wins over confusion every day. When couple and family therapists face differences, they need to respond with a non-anxious presence as taught by family therapist Rabbi Edwin Friedman. A non-anxious presence in the face of RS is a presence that is curious, it's interested, it has addressed any religious traumas and spiritual monsters in their particular history, and it's able to listen to and engage effectively with clients. Competency is characterized as a non-anxious presence when diversity issues arise.
The second quality is drawn from Bowen's family system theory, differentiation. Differentiation is the ability to maintain a sense of self in close relationship with others. It is the capacity to manage one's anxieties and to resist reacting to anxiety in another. Well-differentiated people can recognize that they need others, but also stay calm and clear when there is conflict, criticism, or rejection. They can respond selflessly in the best interest of the family and not respond in overconforming or pouty, rebellious ways. Notice that differentiation with clear non-anxious sense of self and others is a lot like cultural humility with a clear, non-anxious, but humble response to self and others.
The third quality is from Hungarian-American psychiatrist Ivan Bajramini-Nagy, contextual family therapy. He teaches us about multi-directional partiality. It is the quality exhibited in therapy that requires the clinician to attend to and value each other person in the room. Family therapists can distribute justice by creating dialogue with each in the presence of the others. One takes the side of each member with empathy for each position, simultaneously with everyone else. Instead of being withdrawn from the system or neutral, the contextual family therapist engages fully and recognizes the value of each voice in the family. Again, this is similar to cultural opportunities training. Within diversity training, where the multicultural competent therapist can notice opportunities for cultural engagement and support, and can enter into the cultural perspective of the client.
Finally, we draw from the director of the Yale Center for Faith and Culture, Dr. Miroslav Volf. He has identified the tensions between exclusion and embrace. As humans, we want to exclude those who are alien and embrace those who are similar. But Volf argues that competency in RS requires the ability to embrace across differences. Embrace in spite of differences becomes the basis for a healthy therapeutic attachment. Volf wrote of how to live well with others who are offensive or have offended. His context was his life experience of living in Croatia during its civil war. But the application of his embrace principle is not just about ethnic strife. It can be applied to people offended by family injury, by political divisions, and in this context, RS differences occurring in marriage and family therapy. Volf believes that out of our RS traditions comes the capacity to not dismiss others because of differences in values, but embrace them for their value. And our task as the therapist is to address the tension by acknowledging that we are both different and valued, separated but embraced. The tension from difference could be between family members, or it might be differences between our own RS experiences and the client's experiences. We are different and mutually needed.
As we end this first module of training, we have first described how RS competency is an important aspect of diversity. Second, we reflected on our own preconditioned experiences in religion and spirituality, whether we are conventional or not. Our comfort level with religion, using the metaphor of an actor in religion or spirituality, an audience member, or a no thank you. We've considered how culturation is an experience of families in therapy. And we have considered how 4 great ideas of fifth family systems theory could help us build competency in addressing religion and spirituality in couple and family therapy.